Good afternoon, everyone. This is Leanne Bryan from the National Center on Subsidy Innovation and Accountability. It is exactly 2 o'clock according to my clock here. I see some folks are still trickling into the room though. Give it just another couple seconds and then we'll get going. All right, it looks like the folks joining is slowing down, so I'm going to go ahead and kick us off. Again, this is Leanne Bryan. I'm the Program Integrity Manager here at the National Center on Subsidy Innovation and Accountability, welcoming you all to our Year 2 and Year 3 Error Rate Cohort call. So some quick introductions here from the National Center on Subsidy Innovation and Accountability, our Error Rate team. Janae Broadway is over there on the left. She resides in Louisiana, and she is the Error Rate Specialist supporting Region 7. That's me in the middle, and I am the Error Rate Specialist for Region 1. And then Katie Watts is our Error Rate Lead, and she is likely known by pretty much all of you on the call today. She's the Error Rate Specialist for all other regions and provides support for everyone related to error rate. I also wanted to introduce our friends at the Office of Child Care, the OCC Central Office. Adi Fator and Linda Winings are also on the call today. They are the Child Care Program Specialists representing the Division of Oversight and Accountability within the Office of Child Care. I also saw on our attendee list, we have a few representatives out there from the regional offices, so also welcome to each of you on this afternoon's webinar. All right, so here is the agenda for this afternoon. We're going to be walking through the error rate submission timelines and include some reminders for all of you. Then we'll share some clarifications and examples related to the list of topics that you see here, but we'll dig into front end and back end errors, kind of provide some examples of both of those. We'll talk through PII, authorization, and payment amounts. We're going to walk through when to use the mid-table for an additional inquiry, completing column 3, the findings column of the record review worksheet, as well as completing element 500, the case summary. We'll close out the training today with some next steps and additional opportunities for technical assistance. All right, to get us started this afternoon, we're going to do a quick poll. And Katie, if you could please launch the poll for us. But we want to hear, and this is also an opportunity for you all to see what's happening with your peers. What kind of errors are you finding in your case reviews? So for our Year 2 states, I believe all but possibly 2 of you have started conducting your case record reviews. And we have several Year 3 states on the call with us today too that have started their case reviews. They're doing real-time reviews. So again, if folks could please select all that apply, the common types of errors that you're finding during your case reviews.
And the purpose of this poll is really just to get you all thinking about getting you all in an error rate state of mind. We're not actually collecting this information for any purpose, so don't worry about that. Just want to get you all in the right mindset for this webinar. Those income errors.
It looks like, has everybody I don't see, oh yeah, some folks are still responding. Go ahead and select, and then we'll share so everyone can see the responses coming in. Looks like about 49% have voted.
And some won't vote because some states haven't started reviews yet, so or maybe they're not the ones conducting reviews. So yeah, we're at 50%. So why don't we 51? We get to 52. I'll stop.
Well, and some folks might be sitting together or from the same state.
Yeah,
So
sure. Yeah, we
yep.
just got to 53, so I'm going to close it now. But well, Leanne, if you want to walk through the results. Sorry, I don't mean to take over from you.
Oh, no problem. All right, so here you can see the errors that everyone is seeing across the states. It looks like income errors are the most common type that folks are seeing, followed by missing documentation, or maybe that income error is a result of missing documentation, followed by need for care, and then very close in fourth place, I guess, system errors and errors related to change reporting. All right, and this is common. Income errors and need for care are the two most common that we generally see. So on par with previous error findings thus far. No, you're certainly not finished with your reviews yet. All right, can you take us back to the slides, Katie?
Yes.
Okay, now we're going to jump into the timeline for both year 2 and year 3 states. The case review periods are shown here for each of you. I think just to help avoid confusion, I'm going to walk through the year 2 state column, since you're the ones who are up next for submissions, at least when it comes to the state improper payments report. But certainly the year 3s, you're always just a year behind 2 and can follow along in the year 3 column. So where are we at? The year 2s, you see your case review period there, October 2019 through September 30th, 2020. All of our year 2s have submitted and received approval of their SDAPs, the Sampling Decisions, Assurances, and Fieldwork Preparation Plan. If my notes are correct here, the record review worksheets have been approved for all but 2 year 2 states they're in, or maybe some revisions are needed. So the majority of you are definitely on your way with the case reviews. June 30th, this summer, for our year 2 states, that is when the improper payments report is due. Of course, if you get your reviews done a little bit earlier and you are ready to submit prior to June 30th, that is always an option. We prefer that, so please feel free to submit early. And for anyone that has an error rate at or above 10%, you will need to submit a corrective action plan, and those are due 60 days after the June 30th deadline of the 404 report. All right, we can go to reminders. All right, just a couple things for you all. OLDC access. Anyone who is responsible for submitting the improper payments report by June 30th will need OLDC access. If you're not quite sure if you have access or you'll need access, please reach out to your regional office or error rate specialist, and we can make sure that you have the access you need, or if you need additional access or just access in general to the OLDC, we can help work through that and get you what you need for submissions. The joint case reviews, those are held after completing about 3 months of reviews and preferably after the cases have gone through a second level review. So with that being said, if you happen to be seeing a lot of errors, or maybe you have some newer review team members in place and you would like the joint case review to be held sooner, no problem. Please reach out and we'll start getting the planning in progress for the joint case review. Speaking of the planning, prior to that 3-hour joint case review, a planning call is held with the state team to provide a quick overview, any expectations such as what types of cases might be requested by the Office of Child Care. Joint case reviews. Yeah, one final note on this one. If you have completed at least 2 months of cases and you do not have your joint case review scheduled yet, please feel free to reach out. Reach out to the regional office or your error rate specialist so we can start planning for your joint case review. Following approval of the record review worksheet, and as your review teams are getting started on cases, the error rate specialist can provide feedback on a few of your completed record review worksheets. So this review will help to ensure that those record review worksheets are completed correctly, especially with the coding, and that your review team is off to a good start. One final note for this one, I know most of the states on the call today have already started your reviews, but if there is a training for reviewers or maybe a team meeting to discuss some errors that you're finding and you would like either OCC central office or your error rate specialist to sit in on any of those calls or trainings and offer support, just throwing that out as another option for you all if you need some extra help during your case reviews. Any questions so far? No hands raised? All right, I'm going to keep on moving. Now we're going to switch gears a little bit and talk through front end versus back end errors. So you can go ahead and move to the next slide, Katie. During the joint case reviews, during these webinars, you might hear us talking about front end or back end errors. So we're going to break that down a little bit for you on the next few slides and talk through some examples. Quick reminder, the improper payment case reviews are focused on front-end eligibility processes. We are not looking at processes that occur after the eligibility decision. Front-end errors are those errors that occur during the initial eligibility determination or the redetermination. Front-end errors might also occur when the eligibility worker is processing a reported change or some other type of case action. Front-end errors will likely affect the case authorization amount. Back-end errors occur after the child's eligibility has been determined. So this type of error may occur during review and processing of an attendance invoice or when issuing a payment to the provider, just for some examples. Back-end errors are outside of the control of the eligibility worker and therefore not errors for this improper payment review. So let's talk through a few examples, see if we can get some participation here. So here's an example for us. The parent is working 40 hours a week and needs full-time care. The eligibility worker erroneously authorizes part-time care. Is this a front-end error or a back-end error? Would anyone like to raise their hand or maybe put your response in the chat box for us?
We did get a couple of responses, and it looks like everyone's saying front end error. Leanne, are they correct?
Yay! Good job. Yes, this is a front end error. It is an error by the eligibility worker, so front end. Good job. Let's talk through the next one. Similar scenario, the eligibility worker correctly authorizes full-time care. Due to a billing error, the provider is only reimbursed for part-time care. Front end or back end error? Sharon Booker, yep, back end error. Angela, back end, yes, back end error.
Awesome.
Okay, here's our next one. This one might be a little tricky. The family is responsible for a copay of $50 per month. The eligibility system incorrectly processes the authorization, leading to no copay actually being applied to the case. Is this a front-end error or a back-end error? Ooh, looks like we have a mix here. We have some say front end and some say back end.
About 50-50.
Yeah, it does look about 50-50.
So
in this situation, this is a front end error. It happened at the time of eligibility while the eligibility worker was processing the case. Yes, it's a system error. However, it happened during the eligibility determination. This is a front-end error and is counted as an error for the improper payment process. One of the examples, or something that I like to think about here, is somebody who was conducting reviews and, helped pull different types of desk guides together for eligibility workers. A lot of eligibility workers have a desk guide that shows the copay scale. If my family income is X, then my copay is Y. The eligibility worker should be checking to ensure that the copay is determined correctly by the system when the case is getting authorized. Any questions on this one? Would anyone like to talk through it a little bit more? Again, if the error is happening at the time the eligibility worker is taking action, it's a front-end error. I don't see any questions coming in, but if you all would like to talk about this one more later, we definitely can. Okay, you want to move to the next one?
yes, I did.
Oh, thank you. Okay, last one. The family is responsible for a copay of $50 per month. Due to an error with the billing system, the provider's reimbursement includes the $50 copay. Front end or back end error? Yes, I'm seeing several responses come in for back end. Yes, this one's happening during billing, not at the time of eligibility determination. So this is a back end error, not counted as an error for this improper payment review.
And we did get a question in from, I believe it was from Dana in Hawaii. If the worker, and I think this is actually in relation to the last example, if the worker corrected the payment in the same month, then no error. And Dana, it sounds like that, if the payment was corrected, then there would not be an improper payment because, it was corrected. Probably depending on your error definitions, it might be a situation where there's an administrative error because of that eligibility system error. But again, it would not be a payment error.
Okay, if there aren't any other questions, I'm going to turn it over to Katie.
Thank you. All right, so we're going to switch gears, and actually we'll be doing that a lot since this whole purpose of this webinar is just to go over some topic areas where there's been questions and issues. So we'll be switching topics a few times, but the next topic that we're going to go over is personally identifiable information on the record review worksheets. And when we talk about personally identifiable information, or PII for short, we're referring to any information that can be used to trace or identify an individual either by itself or in combination with other information. And of course, we want to Hold on one moment. Looks like there's a small issue with the screen. Hold on one moment.
Yes, Katie, that's my fault.
Okay,
Sorry
no
about
worries.
that, everybody.
All right, no problem. Is it back to normal now?
Yes. Sorry, everybody.
It's okay. Um, okay, so yeah, PII, we want to make sure that the identities of clients, children, their family members, providers, we want to make sure that those identities are protected. These are FOIA accessible documents, your record review worksheets. So you don't want to be in a situation where private info that's included, you don't want to be in a situation where that information could be exposed if something gets FOIA'd. And also when you send us worksheets for the joint case review, they're going through cyberspace. Again, there's that small potential, but a potential nonetheless that something could get exposed. And we do we see PII a fair amount during joint case reviews. We know that you aren't intentionally trying to put personal info out there. And we know that sometimes what constitutes PII can be a bit tricky or ambiguous. So I will do a little exercise. I'm going to show a few completed worksheets elements with PII, and your job is to find it. And if you want, you can throw it in the question, or sorry, in the chat box. You know, what is the PII? So here's our first example. Give you a second to look at it. And when you see the PII, go ahead and, if you want, you can type it in. Yeah, date of birth, good. And we do see birth dates a lot, like I said, in joint case reviews. You may be wondering, why is that personally identifiable information, since there's a lot of people that were born on that day? How can you trace that? And remember, like in the last slide, I said that PII does include information that can be identifying when combined with other info. So birth dates fall into that. You can include the child, if you want to record how old the child is, you can do that in child, you can do the child age in years or months, but not the birth date itself. Right, here's another one. Where's the personally identifiable information here? Yep. Seeing some replies in the chat box. Good. The employee information. And that goes for any employer. I know Walmart, has a ton of employees, UPS has a ton of employees, but it's still going to be considered PII again, because that information could be combined with other information to potentially identify the client. Good. All right, one more. Where is the PII here? Yep. Looking at the responses coming in, a few people have correctly identified the license number. And yeah, this has been the source of some confusion. The rule here is that if that number can be traced back to the provider publicly, then it is considered PII. So if this is a license number where I could go on my computer, Google it, and it'll trace back to the provider, that's PII. If you have an identifier, a number that's only used internally within your state, within your lead agency, then it's okay to include it on these worksheets. If there's any question, if you're unsure, it's best to err on the side of caution and just leave that number out. If the child that there's multiple providers for the case and you want to distinguish them, you can just write provider 1, provider 2. All right, well done on this. So going back to that, going back to the definition I gave a few slides back, here's some examples of PII. And again, these are examples that I say it's not limited to these examples. It's not necessarily an exhaustive list. So if you do have any questions about whether something is PII, please let us know and we can help you with that. Okay. Our next topic that we're going to touch upon today is authorization versus payment. And these are two terms that we sometimes see confused. And we recognize that different states have different lingo. We understand that, but we just want to clarify what we mean when we say terms like authorization, payment, subsidy amount. This most often comes up in element 410, so I'll show you an example of that in the next slide. But first I want to go over the difference between these two terms. Authorization. This is the amount that the state agrees to pay for the child subsidy, either at the time of the initial eligibility determination or redetermination. So this amount comes into play before the actual payment to the provider goes out the door. And we also refer to this as the subsidy amount. So authorization and subsidy are the same thing in the DCI and when you hear us using those terms. Moving on to the right side of your screen, payment, this is the amount that goes out the door, what the state actually paid for the services provided. And often, or really most of the time, these two amounts are going to be the same. What is authorized is what is paid. In some states, it's always going to be the same, but sometimes that payment amount can be affected by things like attendance, if the child does not attend all the days they're authorized for, or if the school ends up being closed for some of that time, or whatever else. And so that amount that is paid is different, usually less than what was authorized. And like I mentioned, we usually see this in element 410, which is the element where the reviewer determines what is the subsidy amount, what the subsidy amount should have been, and then if there's a difference, what is the payment amount. So I want to show an example to illustrate the potential differences between authorization and payment. Say we have a school-age child, and that child was authorized for 4 weeks of after-school care in the sample month. However, they should have only been authorized for 2 weeks, because let's say it's June and school let out for the summer after 2 weeks. So looking at element 410, we'll start with the eligibility worker subsidy amount. Again, the amount that was authorized by the lead agency, the eligibility worker, and that was $200.50. Now the reviewer subsidy amount, the amount that the reviewer says the lead agency should have authorized, is different here. It was $100.25. So the child should have only been authorized for 2 of the 4 weeks. That's a difference of $100.25. However, since the school closed for the summer halfway through the month and the child only attended 2 weeks and the provider was only paid for 2 weeks, the payment amount was that $100.25. Okay, so here we have an example of the authorization being different from the payment. And the reviewer used the comments box here to write out what happened. And so it was determined that this element had, this element had no error because there was no improper payment. Now, if we were in element 340, where the reviewer looks at need for care and what was authorized, there probably would have been there would have been an error in that element, right? Because that was done incorrectly by the eligibility worker, but it did not lead to an improper payment in this case. All right, do we have any questions on this? And I know we're covering a lot of different things in this webinar, so I want to make sure that you all get enough time to digest each thing before we move on to the next one. All right, Kim, I'm going to unmute you. Hold on one moment. Okay. You can go ahead and unmute yourself, Kim.
Okay, got it. Hi.
Hi.
We do have a question about this because in North Carolina, we are using federal funding to pay parent fees. Now we're going to pay them in March and April. We have done many other things before our year started. But the first thing that we're doing for this review year is we are paying the parent fee. So in every instance, the eligibility worker subsidy amount would be the amount at eligibility or redetermination that included the deduction of the parent fee. So every payment is going to be wrong, but it's going to be within the policy. So how will we be coding that? Or is that an offline discussion?
I'm so, what was that last bit? I'm sorry.
Or is it an offline discussion since it might be an odd question?
Well, it sounds like that it would not be an error, or at least it would not be an improper payment error. I probably wouldn't be an error at all, actually. How you actually record it and handle it on the worksheet, that might be something we want to discuss offline.
Okay.
Unless others are having the same issue, we can, because it might be a kind of a unique situation for your state.
Right.
Yeah, but like I said, it sounds like it wouldn't be an error necessarily. It's just kind of a special situation. We'll need to figure out how to take care of it on the worksheet.
Right. We have a reference for it. We have
Yeah.
the reference that says that we're paying the parent fee, so it's within the policy. It just won't match. So we can talk about it more later. Thank you.
Sure. Thank you. Okay. Just checking to make sure there's no other questions that came in. I don't believe there were. Okay. So that looks like there is this same situation is occurring in another state as well. So I will reach out to you too, Angela, after this call. Okay, so we can make sure that, so we can make sure that we have an answer for both of you. Okay, so it's time to shift topics again, and this is everyone's favorite topic, the mid-table. Today, we're not going to spend a ton of time on the mid-table. We're not going to go in depth on the additional inquiry and all of that. We did that last webinar. Today, I just want to focus on when do you use the table in the first place? So we're going to take a step back and make sure that we all understand the different types of errors that we look at in this review. When a case file has an eligibility error, it falls into one of two categories. There are those errors caused by missing documentation or insufficient documentation. And then there are the non-mid errors. Income miscalculations, applying the wrong copay, things like that. Then the mid errors can be broken down further into two types. There are those that cause improper payments and those that do not cause improper payments. Sometimes we call those non-payment or administrative. And the non-mid errors can also be broken down into improper payments and administrative. So in the end here, we have 4 types of errors, and the only errors where you would be completing the mid table are those errors that are caused by missing documentation or insufficient documentation that would cause an improper payment. Okay, so here's a few scenarios to test or put you on the spot again to test your understanding of when to use the mid table. And again, you can use your chat box, or if you want to speak up, you can raise your hand. First, in element 340, I'll go ahead and read this. The case file is missing a school schedule to support hours of care. The reviewer contacts the local eligibility office and they find the missing schedule. Should the mid table be used here? Okay. So we got a few saying yes and a few saying no. Okay. And the answer to this one is no. And the reason for that is because that local eligibility office had that documentation the whole time. It wasn't really missing. I mean, it was missing from the case file that the reviewer was looking at, but it was there. It just was in the eligibility office. They forgot to forward it or whatever. It wasn't truly missing. So in this case, it wouldn't be an error at all. Again, it was always in the possession of that eligibility office. As a side note, if you think about your record review worksheet, or if you want to look at your copy of the record review worksheet, quickly for this element, column 4 would be coded as, again, not having an error. Item 1 would be coded as 0. Item 2 would be coded as NA. And that item 2A would be left blank. The only time that the mid table is used is when 2A is coded as Y. So just trying to connect that to the coding in the record review worksheet. Here's another example. Element 100. The application is missing a signature. According to this state's policy, the missing signature would not result in an improper payment. Mid table or no? Great. Yes. Okay. It looks like everyone said no, and you would all be right. This was missing or insufficient documentation, but it did not result in an improper payment, or it would not result in an improper payment. So no mid table here. And by the way, thank you for all the participation here. That's really great to see you all chiming in. All right, next example, element 400. The income was miscalculated, leading to an improper payment. Would you use the mid table? And actually, when I look at this now, because I see some people saying yes, some people saying no, I could see how this is a little bit ambiguous, because usually when we think of income miscalculation, it's not because of mid, it's because of, just doing the math wrong or typing in something wrong. I suppose that an income miscalculation could theoretically be caused by, yeah, exactly, Brenda. Brenda just said exactly what I was going to say. only if it was actually due to missing or insufficient documentation. If there was a pay stub missing and it led to the income being figured out wrong, in that case, it would be caused by missing documentation and you would use the mid-table. But usually, again, when we see income miscalculation, it's not because of missing documentation, and so you would not do the mid-table. I think we have some people here thinking outside the box, and that's good. All right, here's another example from element 400. Pay stubs were missing, which would cause an improper payment. An additional inquiry was conducted. Yeah. This one's a little more straightforward, but it looks like everyone is saying yes, and that's correct. Missing pay stubs, and it would cause an improper payment. So yes, for the mid-table. One more example, element 320, employment verification was missing, which would cause an improper payment, and additional inquiry was not conducted. Yes, very good. I think everyone is saying yes to that, and that's correct. So this is kind of the same as the last example. There was missing documentation that would cause an improper payment. Whether or not the additional inquiry was conducted is irrelevant here. I mean, that is something that you would record in the mid-table, but in terms of whether or not you're completing it in the first place, the additional inquiry does not make a difference. Okay. Do we have any questions on this? It seems like most of you, at least most of you that are answering here, have the hang of it, so that's great. If there are no questions, I'll move on to our next topic. And that is the column 3 summary. Okay, so switching gears again. And again, if you are not like really familiar with the record review worksheet, I know some of us probably have it kind of burned in our heads, but others, maybe you're kind of new to this, you might want to take a look at the record review worksheet, the different columns, so you can follow along a bit. But the purpose of column 3 of the record review worksheet is to summarize the findings for that element, and particularly the error findings. We don't want to see anything new coming up in column 3. Again, everything should be based off of the column 2 analyses. And also the reviewer should be able to code the items in column 4 solely by looking at 3. And I don't say this here in the slide, but it's best to keep your summary succinct. If you find yourself writing a book for your column 3 summary, that's a sign that you're probably not quite doing it the way we want. Keep it simple. Start by saying whether or not the element had an error. If there was no error, you can just say that. But if there was one, make sure you include whether that error led to an improper payment and whether it was caused by missing documentation. Never leave the column blank. Most states, when customizing their record review worksheets, include a comments box in column 2 of each element. Sometimes there's some questions about what belongs in that comment box in column 2 versus what should be in column 3. And I'll show a couple examples in the next few slides. But the comments box in column 2 is really used to complement the analysis. It can be used to show your work, show the calculations if there's math involved, or just provide any additional information that isn't captured elsewhere in column 2. Sometimes the reviewer will leave it blank if nothing needs to be recorded in the comments. It's optional. Column 3, however, is not optional. It has a specific purpose, as I described in the last slide, and that's to summarize the findings of the element. So for these examples, just a heads up, we don't have a column 4 here. We're just going to be looking at columns 2 and 3. In our first example, we have element 300 and there's no error. Let's take a quick look at column 2. The client met the definition of parent and the reviewer used the comments box to record what documentation was used to verify. So in column 3, the reviewer simply recorded that no error was found. And again, we're really focused on column 3. We're really focused on the error findings, or in this case, the lack thereof. So here's a little checklist for column 3 and elements where there's no error. The reviewer did not leave it blank, and they did not provide any new details. All of the details are over there in column 2. So this is what we want to see. For our next example, we have element 400. Starting at column 2, the income verification was on file, but the income was calculated wrong. It did not impact the copay. So in the comments box, the reviewer provided some additional details. And the reviewer determined that since the copay was not affected, this is an administrative error, not a payment error. So going over to column 3, the reviewer wrote that it was a non-MID administrative error, income calculation. So here's a checklist. We'll take a look at our checklist for column 3. There are no details provided, no new details provided. All of the details are in column 2. The summary describes the error type, non-MID administrative, and it's clear and concise. I could easily come along, take a look at that, and know exactly what happened in the element. And I could also code column 4. Again, I don't have column 4 here, but I could code it based on this information. One more example, this is element 320. And there's a few things going on here. Let's start from the top. Parent 1 met the need for service. The next item is blank. And for the third item, no, the required documentation was not in the file. Looking at the comments box, the reviewer described that parent 1 met the need for service, but there was a change in employers that was not input into the system. And then it says that for parent 2, on the application, the parent's working 40 hours a week, but there's no verification for it. So there's 2 errors going on here. The reviewer determined that, again, according to these state's policies, there's 2 errors. One is a MID improper payment error because of that lack of activity verification. And there was also a non-MID administrative error, and that's because the worker did not update that employment information. Taking a quick look at our checklist, we don't have any new details provided here. The reviewer has described the error types, again, focusing on if it's payment versus administrative, MID versus non-MID. And it's clear and concise. I'm not seeing any questions for column 3. And actually, I've noticed that on our last few joint case reviews, I think the column 3s have been looking a lot better lately. So I think that a lot of you are doing a great job with filling out these worksheets. So we're going to wrap up today's call by taking a quick look at element 500. 500 is our summary element, and this is where we record the findings for the entire case. This is what it looks like in the template. If you're not familiar with it already, there's only 2 columns, like the earlier elements, and this element is not customized. So some general instructions for completing the first column in element 500. some of this is actually really similar to what we just discussed for completing column 3 for the earlier elements. If there's no errors at all, you can just say no error. Or sometimes I might say a bit more. I think in the example in a few slides, I say no improper payment, no errors in any element. Either of those is fine. If there were errors, give a brief description and keep it clear and concise, just like you're doing in the column 3, in your column 3s. Reference the element or elements that have errors. Specify whether the error was caused by mid or not, and whether it was payment or administrative. If you had a mid potential improper payment error that was mitigated through the additional inquiry, you can mention that. And if there was an improper payment error in the case, cite that as well. But don't include detailed analyses. Leave those for the elements that actually have the errors. And like we discussed earlier, those detailed analyses belong in column 2 of those elements. Moving over to column 2 of element 500, there's a total of 10 items to be coded. And I'll go through each of these. For item 1, no error or error. If there are no errors in the case at all, you're going to code 0. And if there were any errors in any element, code 1. Item 2 item 2, missing or insufficient documentation. If there were no errors in the case, if you coded item 1 as 0, no errors, you're going to code NA here. Code N, if there was an error and it was not caused by missing documentation, and code Y if there was an error that was caused by missing documentation. Now I have a lot more written here, and that's for if there are multiple errors. There's a bit of a hierarchy. So I'm going to let you read these on your own in the interest of time, partly because I was rehearsing this earlier and I just stumbled all over myself trying to say it. But basically, we want to code for the payment errors if you have payment and non-payment. If you have multiple errors of the same type, the missing documentation errors kind of take priority. So I want you to read these, and if you have any questions, let me know. I have like a documentation that's kind of like a decision tree to help with this as well. So if anyone wants to see that, I can send it to you. Because this item I think is probably the most confusing one in element 500. Okay, I see a couple people asking me to send that decision tree. So yeah, I can definitely do that. I mean, heck, I'll send it to everyone that's on this call. Yeah, I'll send it to everyone so you can look at it. Right, so moving on to item 2A, and actually 2A through 2E are all kind of tied to the mid table. So item 2A is asking for the number of mid potential improper payment errors that were identified. And you're going to enter the total number of elements that had a Y entered for 2A. Or, item 2A in the record review worksheet column 4. Or you can enter the total number of element rows that were completed in your mid table. And if you had no mid potential improper payment errors, you can just say 0. Okay. For 2B, the total amount of mid potential improper payment errors, enter that dollar amount that you're going to pull from column 3 of the totals row of the mid table. 2C, the number of times an additional inquiry was used. And that's going to be the figure from column 4 of the totals row of the mid table. 2D, is the number of times the additional inquiry mitigated the potential improper payment error. And that's taken from column 7 of the totals row of the mid-table. 2E is the total amount of improper payments mitigated, and that is the amount from column 8 of the totals row of the mid-table. Moving out of the mid-table items and over to item 3, that is overpayment or underpayment. If there was no improper payment, enter NA. And if there was an improper payment, you're going to enter either O or U. Total amount of improper payment. If there was no improper payment, enter 0. And if there was, enter the dollar amount of that improper payment. The total payment amount for the sample month, just again, enter the total dollar amount of the payment that was actually made for that child. You know, we talked a little bit about payments a few slides back. I have a question in, Reginald, each item has to have an entry. Are you referring to element 500, column 2? Each item has to have an entry? Yes. Yeah. So if there are no, if you didn't do the mid-table, you can leave items 2B through 2E blank. Or you can put zeros all down the line. Either is okay. But 1, 2, 2A, and then 3 through 5 all need to be completed. All right. I have some examples here. I know that we're almost out of time. So I'm going to be sending out the slides to everyone, or I already sent out the slides to those who were registered earlier. I'll make sure that everyone who didn't get them is sent these slides so you can take a look at them. But I want you to take a look at these examples. And I'll walk through one of them because we have a few minutes left. This is the case that had 2 errors. There was an improper payment error found in element 400 due to the wrong copay being applied. And there was also a missing form in element 100. And that missing form in this state did not cause an improper payment error. Obviously, I always give the disclaimer that policies vary by state, and there were no other errors in the case. All right, so this, in this case, column 2 for element 500, we coded item 1 as 1 because there was an error. Item 2 was coded as N. So in this instance, there was a missing documentation error in the case, but that did not result in an improper payment. The payment error was not caused by MID, so we'll code 2 as N. 2A is going to be 0. There were no MID potential improper payment errors. Going down to item 3, we've coded O for overpayment. We have an improper payment amount of $25.10. And the total payment amount for the sample month was $225.25. I have one more example here, which I'll let you take a look at in your own time. And please let me know if you have any questions on it, if anything is unclear. Because I do want to take a moment to go over next steps for the year 2 and 3 states. So in the last minute, I want to quick go over this. Our next webinar is for year 2 states will be held sometime in the spring, probably in May. And it will be a training on completing the ACF 404, your state improper payments report. For the year 3 states that are on the call, we actually do have a webinar for the year 3 states next week that have not, those are for the year 3 states that have not yet completed their SDAPs. So they haven't started the process at all. It's like a training on completing the SDAP. Most of you probably don't need to be on that call since you've already started the error rate review. Otherwise, we don't have any other year 3 calls planned at this point. We might hold a case review check-in or another training at some point this spring or summer. If you have any questions, or suggestions for topics that you would like to cover in a webinar for the year 3s, you can let me know in the evaluation for this call or in an email, because I don't want to wait all the way till the fall to have another webinar for the year 3s. We'll hold another error rate office hours on March 10th, so be on the lookout for an invite to that. If you have any questions, need TA before then, please get in touch. And finally, on the right side of the screen, there's a link for our error rate resources page, and that on that website, we have recordings and slides for previous webinars. We have some briefs and some other resources to help you with your reviews. Here's our contact information. Please remember to copy your regional office on any correspondence. And please take a few minutes to complete the evaluation. If you have any questions, you can ask in that evaluation, but we really like hearing from all of you. Thank you for your participation. I hope this was helpful. I hope it was a little bit of fun to take part in the little quizzes. But I hope that you are all staying safe and healthy in 2021, and we look forward to working with all of you on getting your reviews completed. Again, thank you and take care, everyone. Bye-bye.